So it's important to know your risk factors for breast cancer because so many women don't know what their real accurate risk factor is. They they think their chance of getting breast cancer is sky high, and that really frightens them. Some women, on the other hand, grossly underestimate their risk for breast cancer. So it's important to understand what your risk factors are. There are a whole lot of minor risk factors floating out around out there today. And in fact, just recently an article came out saying that drinking alcohol increases your risk factor. And the reality is alcohol, weight, and breastfeeding, whether you breastfeed or don't breastfeed, whether you have children at a young age or not, whether you have menopause at a late age or not, all these are really minor risk factors. The major risk factors really are a family history that's significant. So that your mother having a breast cancer at the age of 70, that doesn't increase your risk. But if your mother had breast cancer at a young age in her 40s or had bilateral breast cancer, that is cancer on both sides, that is a major risk factor for which you should be evaluated. And then there are other risk factors such as hormone replacement therapy, and that particularly comes when you add a progesterone to your hormone replacement therapy. Estrogen alone is not a major risk factor. And then finally, a major risk factor that a lot of women don't know about is breast density. So if your breast is dense on a mammogram, you're at increased risk for the development of breast cancer. At the same time, a dense mammogram is very difficult for the radiologist to interpret. And so in those instances, it's not very accurate to identify some forms of breast cancer. So now women who have dense breast tissue on a mammogram where they're at an increased risk for breast cancer, at the same time these women have a reduced accuracy of their mammogram. So they have increased risk and reduced accuracy, more difficult to identify breast cancer. It's a perfect storm for a woman. So we encourage women who have dense breast to consider getting whole breast ultrasound. Ultrasound can penetrate the breast tissue and look into the breast extremely accurate and identify even the smallest breast cancer. So that every woman who has dense breast, and you should know your breast density, that's available by law on your mammogram report. If you're told that you have increased density in your breast, you should consider getting whole breast ultrasound. Now, whole breast ultrasound is not the same as breast ultrasound that you're used to. Whole breast the breast ultrasound one's used to is targeted to one special area in the breast. For instance, if you feel a lump, ultrasound is targeted to that lump. But that's not what we're talking about here. We're talking about actually doing an ultrasound examination of the entire breast. And if a woman who has dense breast tissue has a whole breast ultrasound, then she can be confident that she has no cancer, and it's normal. She can be confident that her breasts are, in fact, do not contain a cancer. But without whole breast ultrasound, she cannot be confident that when she receives the diagnosis or the result of her mammogram being normal, she cannot be confident that that's accurate. Small cancers can be missed in women who have dense breast tissue. Know your breast density. And if you don't know it, call your doctor's office and ask, are my breasts dense? That information, by law, is required to be on every mammogram report. The problem is, where do you get whole breast ultrasound? That type of ultrasound requires a lot of expertise by the ultrasound technologist, and that requires a lot of experience. We have been working on this process for about 7 or 8 years now, and we've developed incredible expertise and experience with whole breast ultrasound. Not true for many of the centers in our area, so we encourage a woman when she's considering to have whole breast ultrasound to understand where she will have the highest level of accuracy for that whole breast ultrasound. We're really happy and we're really proud here at the Kathryn Candor Lundy Breast Health Center that we have tremendous amount of expertise by repeatedly by ultrasound technologists who are very experienced and have actually been the main people who have developed whole breast ultrasonography and its accuracy. Furthermore, we have expended an incredible amount of money in order to get a whole breast ultrasound machine that actually is applied to the entire breast, and with computers will read right through the breast and examine the entire breast in one examination. It takes about 4 minutes to examine the entire breast. No x-ray, no ionizing radiation, it's just all simple ultrasound, and it's extremely accurate. So when you're considering getting your whole breast ultrasound, know where you're getting it, know how accurate it is, and how good the ultrasound technologist is.